and welcome to Smart Education today. Today we are at Jamia Millia University and we have Dr. N.H. Mullick sir with us. Hello sir.
Hello.
Sir, can you introduce about yourself?
Yeah, I am Professor Naushad Haque Mullick and I'm a marketing professor here, teaching strategic management, customer relationship management, advanced consumer behavior and sales and distribution management. And I have been in the MBA department teaching students, guiding them in placements and looking forward for their careers.
So sir, what has been your journey like in the field of hospital management and hospic studies for these many years?
Yeah, lastly, during these things for a brief stint, I was also in charge of the hospital management and hospices. Now, hospital management, as you see to it, it is an area which is a very upcoming area, and it is providing a lot of opportunities and avenues for students, especially in the management field. When you are talking about, because people previously, they were not at all so much interested or aware of the healthcare, but with the coming of COVID, things have changed. Now, everybody, either you are talking about, because here, if you are talking of healthcare, people were only thinking of getting their checkup done and things like that through insurance, but preventive healthcare was minimal. But nowadays, after COVID and all, people have been very much worried, and they are taking care of their health for themselves, for their family. And not only that, there is a lot of stress coming up in the area, and in every working atmosphere, life cycle balance has to be maintained. And the corporate people are also taking a lot of care for their employees so that they can do better and be beneficial to the corporate. So this is an area which is a very upcoming field. A lot of hospitals are coming, a lot of new technologies are coming. And as you know very well, in India we have hospital tourism, and where because in foreign countries and things like that, there are a lot of spending and a lot of cost in treatment is there. So India has become a hub where patients from Dubai, from Gulf countries, from even US and others for knee replacement or for heart or other things, they are coming. Because we have still, we are one of the cheapest one, and these are providing avenues. New hospitals are coming, new grips are coming, and they are providing better treatment. And apart from the treatment, when hospitals are coming, they need professionals to manage it. Not only the doctors, but they also need the staff also, nursing staff and then hospital management staff. So especially our hospital management, especially this has been, if you see, hospital management with hospice studies. Now hospice studies, if you are talking about, it is basically caring of the people in the older age, which is which is becoming very essential now. People now have money, but in the older, people, they are not getting facilities and things like that. So our department, basically, they are training students, taking graduates in different fields like pharmacy, like Unani and dental and other areas, and we train them for the professionals required, especially in the hospital and managing hospitals. Because in hospital, what it is, you have doctors. They are trained professionals. Now again, the managing the staff and managing the system in a corporate way, that is again and that is where we train our students, and they are very much eligible to take better careers in those.
Okay, sir. So sir, what are the most significant challenges you have seen students facing in the field, and how do you help them navigate those?
See, the biggest problem is getting them trained. It is not that easy, and we provide them projects. We provide them, we teach them through case studies. We familiarize them with the situations. We have field visits also, hospital visits also, and like in different areas, because today it is a very specialized field. So they they contact, and they are in contact with the hospital, with the doctors, with the better people and things like that. They also help, and we give them the training. They are provided summer training, and then the technical level we teach them also, so that they get familiar with the day-to-day life in a hospital. Hospital again, it is, if you see to it, it's a service field, and in service you have the moment, especially in service when you are talking about, it is the moment of truth. Moment of truth when you are talking about, it is if marketing mix when you are talking about, it is the physical evidence, ambience, and the service which is provided, which is again very important. So the credibility and things like that. So they have to be on their toes. They have to see that the people who are coming, they get the right treatment. Right treatment when you are talking about, not only through the doctors, but the care by the nurses and things like that. So this is how we train them and we expose them, and they have got immense, after training, they have the potential to rise high and step through in these corporate hospitals, joining in the lower level, and then moving ahead, starting from management training and things like that, and they can rise up in the career.
So sir, one more last question. Sir, what inspired you to specialize in this area, particular in hospice care?
Yeah, again, see when in India, what is happening. See, not only we are not only starting courses, but we have to see the avenues also. We have to see where the challenge is, where the requirement is. Corporatization is there, organization is there, what is their requirement. They need trained manpower, and naturally we give them skill ready. Seeing the potential coming of hospitals, and especially after the COVID, our expenditure, the government even taking a lot of challenges, and the expenditure in healthcare is increasing, and there's certainly there is a vacuum where we are trying to fill the gap by providing them the right manpower, trained manpower.
So sir, what is your guru mantra or one quote for the students who are watching this?
Working hard is the thing. They have to learn and de-learn, and because they have service is not an easy industry. It is, they have to take care of people. It is the people who are joining, they are in distress, their family is in distress, so they have to take care of all the responsibilities. Lot of avenues are there, lot of opportunities are there. With that, they have to train, and they have to take, because every organization or every hospital has got a mission and vision. So they have to fulfill the mission, because their brand equity which is there, that remains intact with the consumers. And then only if the organization prospers, then only you can prosper, and you can rise up.
Definitely, sir. Thank you, sir. Thank you for sharing
Thanks
your valuable time with us.
Thanks.
So that was Dr. Mullick. Thank you, viewers.